Hey everyone, and welcome back to What After Dentistry. Now, implantology has been gaining quite popularity not just in the dental fraternity, but also amongst the patients. And hence, to discuss on how can a dentist ace this field of dental implantology, today we have with us Dr. Vishal Gupta, practicing implantologist in Agra and Delhi. He completed his BDS from KD Dental College and then pursued a master's program in implant dentistry from the University of California, Los Angeles, which is UCLA in United States. He has also completed an advanced training in implantology under Dr. David Morales in Spain and has over 12 years of experience in handling advanced treatment procedures in dental implants. He is a fellow and diplomat of various international bodies like International College of Oral Implantologists, United States, World Congress for Oral Implantology, Japan, and AOI, India. He is a part of various advanced implant training programs all around the globe and have quite a number of international and national articles published in reputed journals. He has also recently cleared the dental licensing exam for Australia, acquiring another feather in his cap. So let's hear what he has to say on how to ace the field of dental implantology in today's time.
So, hi, Dr. Vishal. Welcome you on our channel, What After Dentistry, to talk about the scope and opportunities in dental implantology and how to ace this field after BDS or MDS. So, welcome you once again.
Thank you so much, Dr. Shireen. It's an honor to be here and sharing my experience with all your viewers. Thank you.
Yeah. So, we would like to know, like, how did you develop your interest towards oral implantology? Because I'm sure, like, back 10 to 12 years back, it was not a much field that was talked about. So, how did you develop your interest towards this field after BDS?
That's a very interesting question, I'll tell you, because it was not just after BDS. Let me tell you, I developed the interest in this field during my BDS. And it was in year 2004, 2005, when I first came across. We were in third year and I was trying to prepare for a competition in a national conference. And we were looking for some new upcoming topics in dentistry. And then implantology come into. And that time it was a very, very new for all of us. Still, it is new for people, but that is how the interest towards implantology started. And slowly we developed it, and I was lucky enough to start my courses very soon in my graduation time itself. And by the end of my graduation, I already had completed about 1.5 years training of implantology also. So that early start is always a better start,
Yes, absolutely. And that's a really good thing that, during your graduation years itself, you started off with some courses or some knowledge gaining towards this field. I think that's an incredible step that you took in your career.
Thank you, Dr. Shane.
So, we know that there are a lot of colleges, there are a lot of courses now in implantology in India. So, we would like to know what courses or which are the institutes that you would suggest for the audience if they want to pursue this field.
See, let me tell you, because to answer to this question, we need to understand some things that if we talk about 10 years, 15 years back time, that time, very, very few colleges were there in which implants were included in some certificate course or something like that. But nowadays, all the graduates who are in their BDS graduate or in their postgraduate, they're lucky that most of the colleges now have their courses which are included during their BDS time or PG times. So that is one way of how you can learn. You can start early in your college. If you have a course in your own college, that's fair enough. But if you don't have, you can look for courses which are going on in the colleges. Okay. Other than that, once you are done with your graduation and that time you want to pursue a course, then there are multiple types of courses are there. Like there are some certificate courses, like they are run by individual doctors or individual implantologists or some institute that is a cluster of few implantologists together. Normally, those courses are like module based. You don't have to be there. You can pursue it with your PG or you can pursue it with your clinical practice also. And even during your graduation, you can pursue it because you don't have to be full-time there. Other than that, there are some university-based courses also, which are like associated with some foreign universities or maybe some Indian universities. But still, as I'll tell you, there are multiple options what you have. So it's up to you to go for a short course or for a long course. And we'll discuss that which has advantages and what advantages do they have later on in the process today. Okay.
Right. Absolutely. So this was where I was asking related to if somebody wants to pursue it from India. There are many universities, I'm sure, many colleges which are offering these courses outside India. So what are those countries where
Absolutely.
one can, pursue?
Absolutely. See, I'll tell you very frankly, if you see, most of the countries or most of the colleges which are offering these courses, most of the time, if you want to go from India and do a course over there, normally they call them master courses, master in implantology, normally they call them. And those courses are like 1 year course or 2 year courses. I'll give you an example. Like there's a university, it's called UCAM, University of Catholic Murcia. There's a small town, a beautiful town called Murcia in Spain. So they have one of the best universities, like UCAM University is there. They provide masters in implantology. That is almost 2 years course over there. And they also provide a part-time course in which you don't have to be there for that long. You can be coming back to your own country, do your cases, and then you have to go for the modules over there. Even in India, we have some courses. Even I'm a part of few courses in which one is the master's course by UCAM University itself. Then there's the university in Korea, Busan University is there. They have some courses going on associated with. The irony is that most of these courses are associated or have been introduced in India. Most of the time they have been introduced by some companies, some implant companies. They have their own tie-ups and they have things like that. But as I told you, most of the universities abroad, which have dental courses or dental university, even Los Angeles University, UCLA, they also have implant full-time master's courses also there. So there are multiple universities which are there. The only thing is, since we always try to avoid being there because lots of things are involved in it, your logistics are involved, money is involved when you go for a full-time course there. And post-COVID, things have become more difficult to go there and do a full-time courses. So you have certificate courses or you have master certificate courses, diploma courses, which are associated with those universities only, but that you can complete in India. Only for few modules you have to go there in the university. So among them, there are many universities, but as I told you, UCAM University is one of the very good courses they have. And you have even a few universities in Germany are there which have good courses. Or as I told you, Busan University of Korea has had some good courses. But there are multiples. Once you get into it, you will come to know there are many options there for you.
Yeah, absolutely. So what are the factors that you would suggest to the audience that they should keep in mind while they are selecting a course or they're selecting a college or any university?
Absolutely. See, I'll tell you very frankly, Dr. Shri, in a classroom of, let's say, 50 students, the teachers are same, the studying time is same, but school is same or the college is same, but few are there who always top and few are there for them that it's difficult to pass also. So personally, from my personal experience, I can always tell you, and that I tell all my participants also in all the courses which we conduct, is that it is up to you. So we should not emphasize too much on what course we are doing. It is on to us that how much we want out of that course. Okay. So first of all, the person who's going for the course or who wants to pursue implantology and they want to go for a course, they should look for a good faculty. That is separate. They should look that the faculty should be experienced. They should try to find out courses or trying to attend courses where they get to do experience or do patient work there, so that they have experience in doing patient work, not only on the models, but on patient also. And other than that, they should try to see whether it is associated with some university. It will be a very good thing, because if you get a certificate with a university name, it is always good to boost up your morale also, and for your patients also to see. And it's always good to have some university associated with. Other than that, if you are not too much into it and you want more and more experience, so as I told you, try to see or go for courses with good faculty and more number of implant placements or more number of patients you are able to see and do over there. Not only on the on the dummy mandibles or dummies, just do it on the patient also. So look for those courses, because that gives you all the experience what you need to do it on your own patients also.
Yeah, correct. I think that's absolutely good. And all you audience, as he mentions very correctly, the factors that you should keep in mind is that the faculty you should look into, and of course, you should have a more of practical, exposure rather than just the theoretical knowledge that you would be gaining from any of the courses in implantology. So very well said,
Absolutely.
and thank you so much for sharing that tip with us.
Thank
So
you.
now,
My pleasure.
we would like to know, like, when I suppose I am pursuing implantology, what are the skills that one should command on once they have once they are done with the course and everything? What are those skills that one should have a good command on?
Absolutely. See, I always believe in this, that implantology is not just a part of one branch of dentistry. It is a mixture of everything. So you have to, when you are an implantologist, you have to think like a prosthodontist. You have to think while treatment planning like a periodontist. You have to work like a oral maxillofacial surgeon. You have to make your diagnosis like a oral medicine person. So it's a mixture of everything there. Okay. So if you see a set of skills, what I personally believe is a person should be patient. That is more important. They should be patient. They should have better skills in treatment planning. Treatment planning is something which is the best and you can say the most important part of a successful implant practice. I always tell all my students that it is not the work what you do, it is the work what you avoid, or what you can say the complication which you can avoid makes your practice a better practice. So treatment planning is the thing on which we have to improve our skills. See, as a dentist, you also know, we also know, all of you also know that normally treatment planning becomes a very small part of our treatment when we are going for implantology or anything. But that should not be the way. The maximum time should be spent on treatment planning. I'll give you an example. In our practice, whether it is the Agra clinic or whether I'm in consultation, Delhi or any other city, the first appointment or the treatment planning appointment, we spend at least half hour to 45 minutes with the patient, explaining, planning everything with the patient and ourselves. For placement of implant, many times for placement of a single implant takes between 5 to 10 minutes only, or even for a full mouth case may take in half an hour or on an hour time. So your treatment planning should take more and more time. So the skill set which is there is, you should start seeing or planning your treatment properly, because as I always say, whatever you plan or you tell your patient before you do a surgery is called treatment planning, and whatever you try to tell your patient after the surgery is just an excuse for the patient. So the best skill, I won't say that you have to be a good surgeon, you have to be a good prosthodontist or good periodontist, because there is, according to me, there is no criteria for good, best, because it all depends upon case to case and a person to person. So a good implantologist has to be the most patient guy in the town. You have to be the patient person and planning nicely. The skill of planning treatment is the key to success in implantology, let me tell you.
I think that's absolutely correct, because if you plan the treatment properly, as you said, at the start of the answer, that the complications that you need to avoid, I think that can be done only when you plan out the things correctly. So absolutely,
Absolutely.
that's a good take-home message for all you audience. So now, we would like to know, like, how has this field evolved over a period of time, both from an implantologist perspective and from the patient's perspective also?
I'll tell you, I've been very lucky to see or to be at the time or enter the field at the time when it was a part of a change or transition, what I can say. Because as I told you, I did my first implant on 10th December 2006. I remember the date because that date I cannot forget. So it's been almost 15 years, 14, 15 years time now. The change what I have seen is being one of the first implantologists, initial implantologists in my city also. We were at that time, we had to convince a patient a lot about implantology. And we made sure, or I made sure that each and every patient who comes to my clinic, whether the patient comes just for a cleaning setting or maybe for a filling, should go with the knowledge of implantology. They should know what dental implants are, because potentially they will tell to some other person or ever they need it in future. So we had to do that. But over a period of time now, if you see, especially for the new implantologists who are coming, there is a field which is already set. So now when a patient comes, almost 80 to 90% patient already have some idea about implantology or dental implants, because some of their relatives or some other dentists must have advised them or something like that. So over a period of time, this field has evolved. Like, we don't have to convince them too much, because that work has already been done by the relatives or Google or internet, or you can say the platform like your Dr. Shreen. They give good information. So sometimes they have some amount of information. So that is how this field has evolved for the patient. And how it has evolved for us as implantologists is long back, or 10, 15 years back, the instruments, or you can say the implants or grafts, it was not very easily accessible, what we can say. They were, but there were not much options. But now the market is big and there are hundreds of options for us to choose and go for the best. That is how it is evolved now.
I think that's absolutely great. And how do you foresee the future now? We talked about how it has evolved, but what is the future feel now?
See, I always say that if in today's world, if you don't practice implantology in your clinic, I'm not saying you do it yourself, but if you're not giving an option of implants, dental implants to your patient, you're not doing good to the patient. Ethically also, that is not a thing. You have to give the options to the patients. So what we can say is that it has become such an important part of of dentistry that it cannot be avoided. And the future is even going to be brighter, because it's a simple thing. Let's take an example. If we have to, let's say, talk about 20 years, 30, 40 years back, even a complicated surgery would have been done, not only dental, but anything could have been done by a simple x-ray or anything like that. But now, even if we fall from a bed, we go and get an MRI done or a CT scan done. Why? Though they are cost-wise different, but because the new technology or advanced technology is present. The same way, dental implant is present, and if you're not giving that option to your patient, you're not doing 100% justice to your treatment and to your patient. So that's where the future is bright, and it is going to take off like before and never seen before.
So all your audience, this particular field of oral implantology or dental implantology has a good scope, has a good, future is bright, as Dr. Vishal says, because now the patients are also aware of this particular kind of treatment that is being offered by the fellow dentist or fellow implantologist in the country. So, we would like to know, if somebody pursues this field and has been practicing, say, for 2 years, 3 years, as an implantologist in their private practice, what are the other career avenues that open up for an implantologist?
See, if you can say, ironically, or till now, we don't have any postgraduate program, or you can say a degree program in implantology. Like it is still not like a prosthodontist or an oral surgeon or a maxillofacial surgeon or an endodontist or any other branch of dentistry. Implantology still doesn't have its own master's degree or something. It has been incorporated in all the branches somewhere or the other. So if you talk about how to pursue or what other fields it can, or other ways, is, first of all, if you are in a private practice, that is an important part of your private practice. But if you pursue your teaching career or things like that, you can be part of, if you have a good knowledge of implantology, good experience, you can become part of different colleges as implant faculty for their implant courses, or you can get associated with some companies or maybe some other universities, and wherever they have their courses, you can always be a part of them. And that is also one of the way how you can pursue your career in implantology. But yeah, clinical implantology is still one of the major part of the career, what you can say, related to dental implantology.
Right, correct. And can somebody also try to do research in this area?
Absolutely. There is lots of research going on, whether it is based on implants, whether it is based on bone grafts, membrane used in these in implantology, or there are lots and lots of research going on. But as I told you again, there are lots and lots of research going on abroad also, in some of the universities in our country also. So once if you're really interested in research, then you should go and search in your own university sometimes, or even if you go for some PhDs are also going on in some of the universities abroad in India also. So there are lots and lots of stuff which can be done. Not only the clinical implantology, but if someone is more into academics and into research, there are many options related to implantology. And being a relatively, I won't say a new branch, but relatively new, so there's still a hope of lots and lots of development in this field, or lots and lots of research in this field.
Absolutely. So all you audience, as an implantologist, you just cannot work as, if you don't want to work as an implantologist or as a consultant into clinical dentistry, you can also try and open up avenues into academics or research, but make sure that you have a good network of people around you. You are associated with all these international bodies that we have. You are associated with good colleges or universities if you want to get into the academics or the research side of implantology. So thank you so much for sharing that insight, and it's good to know all these points. So when this pandemic started, we knew that how this has impacted people. Patients were not coming to the clinic; they were only coming for emergency cases, and so on and so forth. So how has a pandemic affected this field?
That's a very good question. I'll say what I've seen over a period of this 2 years is it has affected in both direction, or it has changed things in both direction. Like, let's take a negative feedback or a negative thing which came up was normally implantology, we have lots and lots of patients coming from abroad. Dental tourism, if you take implantology, plays a very, very big part in that. We have lots of patients, or we have lots of crowd coming from abroad to India for their dental treatments, and especially implants, because there's a big cost difference there. And so those patients, we were lagging those patients in these because of the travel bans and everything, and even interstate within India also, because the movements were there, so it was all postponed, and that is how it affected the patients. But if you see a positive way, the patients have developed little bit more faith in doctor, plus they have developed a faith, or they have developed, you can say that they want to take care of themselves more now, because they have seen in this pandemic time that how much important is the health. So now they don't want to take chances. So if you tell them a good option, and even if they have to spend something on it, they won't hesitate. This is one change which I have seen, which is a positive change, what I've seen. And it's a very positive change for implantology or as a dentistry on its own.
So now, since we know that you have two successful dental implant practice, one in Agra and one in Delhi, please share some tips with our audience. How can they have such a successful dental implant practice?
I won't say it's successful. I'm trying to do my part, what I can do to help everybody or help my patients. See, I'll tell you, I personally, because I've seen the practice in a city like Delhi, a bigger metropolitan city, even in a city like Agra, which is comparatively a smaller place. But I personally tell to all my students also, always remember, it doesn't make a difference whether you are in a big city or in a small city, because we forget that whether it's a big city or a small city, it comprises of people, and we as Indians, we are same whether we are in any city. So the thing is, you as an implantologist or a dental practitioner, you have to have set of skills which makes you different or apart or more desirable as an implantologist or as a dentist to your patients. Then you can have a successful practice, whether you are in a smaller town or even in a small village or even in a big metropolitan city. So you have to have a set of skills, or you have to show your patient a set of skills which makes you ahead or gives you ahead than your other, you can say, people who are working in the same field. So try to keep yourself motivated and keep yourself updated, so that your patient can also see that and gets attracted towards you.
Right. I think that's a very, very important thing. And the more you update yourself, the more your knowledge also, you can showcase your knowledge, you can showcase that skill to your patients. And of course, with when the patients build up that trust, they will definitely not go to any other person or any other doctor.
Absolutely.
So, now since you mentioned big city and small city, my next question was revolving around this only. Many times, we as dentists have this perception that, fields like implantology or fields like oral maxillofacial surgery, they only flourish in big cities. But since you have been practicing in tier two cities, how do you convince patients, or how do you deal with patients, or tell them that no, this oral implant or getting a dental implant is a much better option rather than going with other, RPDs or FPDs kind of treatment?
Absolutely. See, first, the basis or the best way of convincing a patient is you need to convince yourself. If you think that implant is a best option in that particular treatment, then if you are convinced, it's easy for you to convince your patient, because patient has chosen you or has come to you as your dentist. He is trusting you. So if you are not confident, if you think that this is not a treat, you will never be able to convince your patient. You yourself will take out ways of unintentionally, you will take out ways, or your treatment explanation will be that patient will never convince with the implants. You have to understand that. And that reason can be because you yourself are not sure about implants, or you yourself don't do it. So many times you want to avoid that treatment. So you are not able to convince the patient for that. Remember that a patient coming to you, being an implantologist, if you yourself are sure about it, you're convinced that, yeah, this is the right treatment for your patient, believe me, that makes your work half done, and it makes your work very easy to convince to the patient. Rest, yeah, I understand that financial aspect plays a very, very important role, especially in an economy like India. It plays a role. But again, you have to give options to your patient. It is your moral duty to give options to your patient. So that I'll never say that you have to cut down the cost. No, you have to give them an option that, yeah, RPD is also an option. Let's give an example. Like if there's missing central incisor of a patient, two central incisors, two upper teeth anterior are missing. You have to give a patient RPD. You can give a patient a fixed bridge, or you can give a patient an implant processes. So all three, you have to give the patient these three options, and you have to tell pros and cons of all these three options, and let patient decide what is best and what he and she can. Instead of that, what we try to do is we try to tell patient or emphasize on the treatment which we think is better for us, whether it is financially better for us, or because of our limitation in clinical skills, we try to limit it to that thing. So that should not be. So how that is possible is by training yourself. You have to, if you are an implantologist, that don't give you an excuse of making a non-functional or not a good RPD or not doing a good crown cutting. That is not the, that doesn't give you. You can't say that I can do a good sinus lift, but you do not a good crown cutting. That cannot be done. So you have to train yourself, or if you can't train in everything, you need to have set of other specialists, or let's say your staff or other doctors with you who can do better than that. So, but you have, it's your moral duty, and it is our moral duty to give the best. So if we are giving the best option, believe me, a patient who can afford will go for that option. Until unless financial plays a very, very important role, then some special patient, you also are a good judge. We all are humans, and we should not forget the humanity. If you can help someone by bringing some cost down or anything like that, you should do it. Or you can refer them to some colleges. There are so many colleges nowadays where this treatment is going on, which is a little bit cost cutting also is there because it's a training institute. So you can redirect or direct your patient to them also. Only those patients who can't afford them. Rest of the patients, you need to keep it to your practice. You can't send them all to other people. Okay.
All you audience, there is no differentiation whether it is a big city or a small city. You have to make sure that you have good command on implantology. You should be convinced with yourself first, and then you need to, tell the treatment to the patient. And of course, put all the treatment on the in front of the patient. Like these are the various treatment options, and then let the patient decide what is best for them from all the perspectives. So I think that's a very,
Absolutely.
very good take-home message that the audience can take from our session today. So, Dr. Vishal, what is your last tip or advice for the audience who want to get into dental implantology?
See, I'll tell you, never stop training, or never stop, or never say that I've learned it all and let's just go into work. Do your work, and the key to success is keep on learning. I'll give you a small example. I'll give you a small story. When I was in my college time, in my fourth year, third year, when I finished my first implant course, I thought that I am the most intelligent person in my college, because most of the, or 99% of the people were not doing implantology that time. And I thought I'm the most smartest person of them all. But it didn't took me long. Within a year time, I realized that I've not learned anything. Then I have to go for another course. And similarly, that things keep on doing it. Still, if I get to learn something, some new thing, or some new technology, some new instrument, some new ways, I try to keep updating my knowledge. And let me tell you, to all my friends, the youngsters or the young friends, or the young implantologists who are going to be part of implantology family in future, is never stop learning. Because if you stop learning, you are not able to plan things out. There are lots of evolution coming up. There are lots of techniques which you learn today will not be used in future, or some other technique will be used then. So keep updating your knowledge. That's the mantra for success in any field, especially in a field of implantology, which is keep on evolving in these coming years, and future is very, very bright, very, very bright.
Absolutely. I absolutely correct. So thank you so much, Dr. Vishal, for coming on our channel and sharing all the insights on how to ace this field of dental implantology. I think this is one of the most advanced fields that, in dentistry we have, that keeps on evolving, as you said, and keeps on upgrading. We have so much to learn in this particular field. So thank you so much for sharing all the insights with the audience.
Pleasure was all mine. And as I say, from my side, I really thank you guys, because it's a very good initiative on your part for helping all the newcomers, or even I say who are already into field, to get good knowledge. And we are also there. I'm there to help anybody, anytime, if they need any information. We are always there to help you out. And from my side, I'll wish all of you all the best, and all the viewers. Thank you for listening to us so patiently, and all the best for your bright future to come in implantology and in the field of dentistry. Wish you all the success. Thank you.
Thank you so much, Doctor, for all the appreciation. And yes, of course, for all you audience, I will be sharing Dr. Vishal contact details in the description box, so you guys can check it out. And if you want to connect back with him or learn more about this field, please do so if you want to get into oral implantology. And thank you everyone for patiently listening to our session today. I hope you got motivated, and you learned more about how to ace into this field, how to excel into this field. So thank you so much, everyone. And I will sign off now. Before I do that, As I always say, please subscribe to our channel. It's absolutely free. Like and share this video in your network so that it helps out people who want to get into the field of implantology after BDS or MDS. Thank you so much, everyone, once again. I will see you in the next video. Until then, bye and good luck.